Hi, my name is Gary, and this is my population level health education intervention presentation. So the community that I selected for my project was Stockton, the 95203 zip code, which you can see here outlined in red. Health issues, diabetes, chronic disease management for diabetes, poor glycemic control, lack of health access, lack of health education, and few resources for medicine or diabetic supplies for issues in this community. Nutrition, and specifically nutrition for diabetics. There is a lack of fresh food options. There are no major chain grocery stores. It's what you could consider a food desert. There are some fast food chains, some street vendors, but there's a lack of transportation as well to get to grocery stores that provide fresh food. Background is significance. Significance to community-oriented nursing practice, unmanaged diabetes, and poor nutrition can lead to hypertension, blindness, obesity, chronic wounds, poor quality of life. Background, the epidemiological data, the racial ethnic makeup of the area breaks down to about 52.2% Latino or Hispanic, 47.7% white or Caucasian, which also includes a portion of the Latino population that identify as white, 10% Black or African American, and about 8% Asian, according to American Fact Finder. The significance of this is that 10.4% of Hispanics and 11.8% of non-Hispanic Blacks have diabetes mellitus, and we compare that to 6.6% of non-Hispanic whites and 7.5% of Asian Americans. So in this community, there's a large population of Hispanic people that have a higher prevalence of diabetes. There's a smaller but still significant population of Black people who also are more predisposed to diabetes. So there is a huge need for diabetic education, disease management, and also nutrition in this area. Poverty is an issue in the area. 33.9% of the individuals are living below the poverty level. There's poor health literacy. Over 28% of the population lack a high school diploma. 11% of the families have no personal vehicles, so and also public transportation options are very limited, so it's difficult for people to get to areas where they can get good food. There's a large homeless population. An area shelter provided services to over 3,000 people in 2015 alone. Healthy People 2020 objectives, diabetic disease management. So we want to increase the number of diabetic adults who perform blood glucose monitoring and engage in physical activity at least once daily. And monitoring blood glucose and increasing activities can reduce complications related to uncontrolled diabetes, which would result in a healthier community. And the Healthy People 2020 objective in terms of nutrition would be to reduce consumption of added sugars and excess calories and increase the total proportion of vegetables in the diets of the community. This goal of reduced sugar and increased vegetable intake would help stabilize, decrease blood sugar levels for the population, which would give us a better health status in that area. Needs assessment. The biggest contributor to the needs assessment was actually the windshield survey. Driving through this area, specifically mindfully looking for issues, looking for concerns, trying to get a good picture of what the community needs and the condition of the community was the largest contributor to getting an understanding of the issues in this area. Also conducted government level research. The United States Census Bureau, the American Fact Finder was very helpful. More locally, through the Human Service Agency of San Joaquin County, they had a lot of good information. Also, the Office of Disease Prevention and Health Promotion had good information. Did some community level research at St. Mary's Dining Room, Stockton Food Bank, Stockton Shelter for the Homeless, Boggs Tract Community Center. Those are all services and centers that are in the 95203 zip code. For my interviews, my community members, I spoke to people who were actually employed in some of those community centers and shelters. I actually spoke to a few homeless people that were in the vicinity who had a moment to talk. And my key stakeholders, I spoke to a director at the food bank and a Board of Education member who seemed to have a pretty good idea of the issues and concerns in the community. Theoretical framework and needs assessment, the precede-proceed model, which is described as a comprehensive structure for assessing the health needs, for designing, implementing, and evaluating health promotion and other public health programs to meet those needs. Precede, that portion is predisposing, reinforcing, and enabling constructs in educational diagnosis and evaluation. Or in other words, we take a look at the issues in the community and the factors that contribute to those issues. And proceed, policy, regulatory, organizational constructs in educational environmental development. So we take a look at the organizations, the structures, the resources in that community, how they can be used, what we can do as interventions, and what those outcomes will be when we implement those interventions. So this is a diagram of the model, and started by the Windshield Survey, which gave me an idea of health status, quality of life, the environment, the lifestyle, speaking with people, the Windshield Survey, doing research, reveal some of the predisposing factors, things that reinforce the issues in the community. Took a look at the organizations that were there, that were available to help with the issues there, and then implementation, designed some classes that I wanted to conduct to see what I could do to help. And then took a look at the impact of those classes and the outcome, which are both short-term and long-term. So the outcomes will be measured by improvements in the health of that community, and also by if we raise awareness, which I think raising awareness was done. Improvement in health, that remains to be determined. Issues in education and practice. The barriers in this community are the large homeless population, the extreme poverty, the poor health literacy, and general lack of education, lack of fresh food options, and lack of public transportation. Those are large barriers. The assets this community has, they actually have some pretty substantial assets. They have shelters, they have community centers, Boggs Tract Community Center is very helpful. They have food banks, they have medical clinics. The medical clinic at St. Mary's Dining Room does a lot of good work. Specific behaviors. The primary behavior is a willingness to change and engage in healthy activities. If we can have that, we can accomplish a lot. Knowledge and skills. The biggest functional skill would be blood sugar testing, learning how to monitor blood sugar and getting the equipment for people to learn would be very important. Also, knowledge, understanding diabetes, what it means as a disease, what it can lead to if it's not controlled. In terms of nutrition, the relationship between food and sugar, carbohydrates, that they are in fact sugar, bread and pasta and all those good things we like to eat, soda, that it's not very good for you, as well as juice. Juice has a lot of sugar. Many people didn't realize that. Resources, blood sugar testing equipment and medications. This possibly could be many hundreds of dollars, or free depending if we can get people signed up for Medi-Cal, Medicare, or if they have health insurance through VA. I met one gentleman who did have that. Nursing, health, community services. There are facilities in place. There is some infrastructure there, but they need improved funding. They need donations, both durable medical equipment, medical supplies, medications. They need ongoing food donations, and they need the time of health professionals to volunteer. Interventions. I conducted 2 classes, 2 educational services at St. Mary's Dining Room. The first class was managing chronic diabetes. So I spoke about diabetes and its complications, the issues that come along with it, such as high blood pressure, such as stroke, blindness, chronic wounds, risk factors, alcohol, tobacco, the things that could contribute to having diabetes, medication management, oral medications versus insulin, the importance of exercise. A lot of people are unaware that exercise can actually help manage blood sugar levels. The importance of doing foot inspections to avoid wounds or to have wounds addressed as soon as possible, and blood sugar testing. Class 2 was nutrition, specifically for diabetics. So we talked about what calories are. A larger person needs more calories than a smaller person. Types of sugar, that carbohydrates such as bread and pastas and noodles and things are in fact sugar. This sugar is not just the white stuff that comes in a bag that you sprinkle in your coffee. A lot of people didn't seem to have a good grasp on that, so that was important to explain. Fresh vegetables, that we can get a lot of good nutrition and help maintain good blood sugar levels by eating vegetables. Reading nutrition labels, that could be a separate class in itself, and I wish that I actually had more time because there wasn't enough time to really get into that as well as I would like. So that may have caused more confusion. I may have been better served just leaving that out and doing a single class just for that. Also, food resources. I handed out information such as they knew about St. Mary's Dining Hall. They provide 3 meals a day for people, but also the Stockton Food Bank. Not everyone is aware that they can go there for food resources, also the CalFresh program, that they can go to the Health and Human Services Agency, which is not located too far outside at 95203, and that they can sign up for CalFresh, which is the new version of food stamps, to get some food help there, and did some more blood sugar testing as well. Class format, we discussed things in layman's terms, try to avoid medical jargon, use simple terminology. Did a lot of demonstration, did verbal pop quizzes, so we explained something, then ask some questions and see who remembered. Did teach back. Teach back was very important. Talk about something and ask someone to explain it back to me or show me what we had just talked about. And did extended question and answer period. A lot of people have a lot of misconceptions or a lot of, or just a general lack of knowledge about both diabetes as a disease, how to control it, and what good nutrition is. Budget. For my class, a grand total of $22.06 I spent. That was all on printed materials. I made flyers, I made handouts. I made a small sign, not very big, but it just fit into a little plexiglass sleeve that stood up that people could see. And that was $22.06. Equipment, glucometer, test strips, lancets, gloves, alcohol wipes, gauze, bandages. Those were donated and loaned to me by my employer, Lodi Memorial Health, so I was very happy about that. The facility, the room, the table, the chairs, the electricity, the lights was all graciously provided by St. Mary's Dining Room. If this was an ongoing project, the budget, I think, would be approximately about $20 a year. Say $20 for printed materials for each class. If I conducted one diabetic disease management class and one nutrition class, so 2 classes a month times 12 months, it'd be about $480, around up to $500. The facility, St. Mary's, encourages health professionals to come do education, to come do screening, to do training, so they would be more than happy to provide the facility for me. Equipment, I would try to request donations from area hospitals, medical offices. I could explore writing grants, so I think I could keep that cost down to very nearly zero. Staff and training, I could recruit volunteers and also reach out to nursing students in the community. I still have some good contacts at the community college that I attended. And so the staff cost, the employment cost could be zero. Training would just be a matter of investing some time. Project evaluation outcome measurement. Objectives, Healthy People 2020 seeks to increase the number of people who test their blood sugar at least 1 time daily. Short-term goals, to raise awareness of the risks and complications of uncontrolled diabetes and poor nutrition. Measured. I measured this by primarily the discussion and answer phase, asking questions in my little pop quiz and seeing if people were getting the answers right. Blood sugar screening, I handed out information, and both on healthcare resources, how to sign up for Medicare, Medi-Cal, the area clinics such as San Joaquin General Hospital and the clinic that the hospital runs. Also, St. Mary's Dining Hall has their own clinic, and handed out nutrition resources as well. Long-term goals would be to reduce complications from uncontrolled diabetes and improve the nutritional status of the community. And I think we can measure this in changes in data very long-term from the U.S. Census, such as American Fact Finder. Also long-term, but a little more recent, would be information provided by San Joaquin Human Services Agency. They do provide a lot of information about the health and status of the community. And then also a reduction of the needs reported from community health clinics and food banks. Maybe not so much needs, but information from them regarding the general health of the community, to see if the complications of diabetes, such as those reporting high blood sugar or hypertension, stroke, chronic wounds, if those things decrease, then perhaps we're getting a handle on managing diabetes. So the one way to measure. Results and conclusions. Main point, I wanted to raise awareness. I think I did that. I referred several people to either their primary care provider or to one of the clinics in the community for follow-up. Several people had blood sugars in the 300s. Some people were in the pre-diabetic range, and then some people were in the normal range, and a lot of people were very relieved that they did not have diabetic level sugars. So awareness was raised in that point, and some people, they were able to see that what they were doing was working. The diet that they were eating, the medication they were taking was effective in managing their diabetes. The weaknesses in the project: Spanish language proficiency. My Spanish skills are very, very basic, remedial at best. So I could have used either a translator or improvement in my own Spanish skills. It would help me quite a bit. Information overkill, talking about nutrition labels. If only I had more time or had a separate class for that, that could be all on its own. That was not very successful in that area, but I just didn't have enough time to really get into it. And a dedicated classroom space. The area that I had available to use was an alcove off the main room, the main dining hall. So there were some distractions in terms of noise, people walking by, and some people walked in and out. So it would have been nice to have a more private, quiet space. Problems encountered. Could have used an assistant or more for the blood sugar screening, but I only had one glucometer, so it wasn't really a non-issue there. But some people got tired of waiting their turn to get their blood sugar screened, so left before we could do that. Would have been nice to have some more help, a little bit more equipment to screen more people more quickly. And suggestions, I'd like to advertise this, would be ideal. And the on-site clinic at St. Mary's could refer people who need education. So that would be one way to coordinate between the on-site clinic and the education classes. And once again, a quiet, more private space, so that way there's less interruptions and less distractions would have been very useful. These are my references, and I want to thank everyone for watching my presentation.